Hey, Marcia, how are you?
I'm fine. How are you?
Good. I owe you an email, but I wanted to ask you tonight, would you be the timekeeper when we have public comments, somebody has to keep track of when 3 minutes pass? And I tried to do it last time, but I couldn't do both. I couldn't listen and
Okay, sure. So 3 minutes. I have my cell phone with
Yeah.
a clock on it. That'll
Yeah.
do. Huh?
you just, when they start talking, just punch the stopwatch, and then when 3
Oh,
minutes is
okay.
up, just say 3 minutes is up, so.
I gotta find the stopwatch.
Oh, it should be on the clock, yeah.
Yeah. Oh,
Thank you.
gosh. Sandra, yeah, sure.
Hello.
Hi.
Hi. I found the stopwatch.
Okay, thank you, Marcia.
I'm expanding my electronic experience here.
Yes, electronic IQ, right?
IQ, absolutely. It never hurts.
Right.
Hi, Hendrik.
Hey, Marsha, how are you? Hey, Sandra. Hey,
Hi,
Samantha.
Dr. Schultz, how are you?
Adam. Hey, Tom.
Hi, everybody.
Good. Yeah.
Henrik, you look like you're hosting a podcast or something like that.
Yeah. No, this is just to keep the background noise out.
Yes.
Yeah. Yeah. We have a little puppy, and unless you want to hear all the barking and yiffing, I think it's better if I do it this way.
Well, it's 6 o'clock, so I will call the meeting to order. We'll start with roll call, please. Could you call that for me, Samantha?
Sorry, I was muted. Adam? Adam, are you there?
Yeah, sorry. Can you hear me?
Yep.
Thank you.
Hendrik?
Yep.
Marcia?
Here.
Amy? Here. Tom?
Here.
Jess?
Here.
And Sandra?
Here. Thank you. At this time, anyone may speak to the board about business that appears on the agenda. If you would like to speak, please raise your hand on Zoom, state your name and home address. And we have allotted 3 minutes per person. Is there anyone who would like to speak tonight? Please raise your hand. I don't see anyone. Samantha, do you?
I don't see anyone either. No.
Okay. We'll go ahead then, and the next thing on our agenda is to approve the agenda. Are there any modifications that anyone would like to suggest to the agenda tonight? Hearing none, then could I have would someone make a motion to adopt the agenda?
This is Hendrik. I make the motion to adopt the agenda.
Thank you. Is there a second?
This is Marcia. I second.
Thank you. The agenda is approved. The next item on our
Sandra,
agenda.
do we need to take a vote on that? Sorry.
For me?
Do we take a vote on the agenda or?
Oh, thank you. Yes, let's go ahead. Just to do a voice vote. All those in favor of adopting the agenda, please state aye.
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 Opposed, nay. Okay, now the agenda is approved. Thank you, Samantha. The next item on the agenda is approval of minutes. And we do have 2 minutes to approve, the January 19th meeting, 2022, and our special meeting, which was held on February 9th, 2022. Dealing first with the January 19th minutes, are there any additions or corrections to the minutes?
This is Tom. I move to approve.
Thank you. Is there a second?
Yes, I'll second.
Is there any discussion? Hearing none, then let's take the vote. All those in favor of approving the January 19th, 2022 minutes, please state aye.
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 I,
Those opposed, nay. Okay, the motion passes and the minutes are approved for January 19th, 2022. Moving next to the February 9th, 2022 minutes. Are there any additions or corrections to those minutes? Hearing none, is there a motion to approve the February 9th minutes?
I move we approve the February 9th minutes, Sunleaf.
Thank
I
you,
second
Amy.
that, Schultz.
Thank you. Is there any discussion concerning this motion? Hearing none, then let's take the vote. All those in favor of approving the February 9th, 2022 minutes, please state aye.
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 Those opposed, nay. The ayes have it and those minutes are approved. The next item on the agenda are updates from the chairperson, myself. And what I would just like to add tonight is that I want to make sure that the members of the board have ample opportunity to have a robust discussion during our meetings. And to that effect, last at our special meeting, you heard me oftentimes ask, is there a motion? Once we discuss something for a while, then I would ask, is there a motion for this? And then we would seek a second. The reason we do that is to move the meeting along, but not to stop discussion. So once there's a motion and then there's a second, then we can have more discussion, and we want more discussion at that point. It's not the time to cut off discussion. We just want to discuss it. Some motions will be made and there will be no second for those motions. And what we will do then is just move on. The motion fails because there's not enough interest in it. So it kind of helps us move the meeting along. We did get sort of a summary of Robert's Rules of Order when we got our orientation from the Iowa Department of Health. And Samantha is putting that up on the screen right now. And I'd just like to reiterate that the Robert's Rules of Order were created to protect the rights of the board members. And in protecting people's rights, it allows you to conduct an efficient and effective meeting. Robert's Rules of Order are not intended to squelch differences of opinion or controversy, but for board members to feel protected. Using Robert's Rules of Order gives everybody the same rights to speak, to be heard, and to vote, and to assure everyone's viewpoints are treated equally. So to the best that we can, we'll try to follow the Robert's Rules of Order. And so what's up on the screen right now is a summary of the Robert's Rules. And like I said, it would be in your orientation packet from the Iowa Department of Public Health. But if you'd like a copy of this, I'm sure that we can get it emailed out to you. The sheets that we have showing right now, it kind of shows the general progression of business to be dealt with at a meeting. And then it also shows the procedure to enter a motion for consideration. So I just wanted to kind of review that, and I wanted to make sure that you knew that when I say, is there a motion, it just means I want it to be really clear what we're talking about. And then I want if there's a second to that motion, then we should have debate and discussion going forward. until we get to a point where we can take a vote on that motion. So just a little reminder of that, and hopefully we can have robust discussions about anything that comes up during our meetings. One thing I did want to say is that our meetings will be moving to in person after this meeting, I believe, and but we will still continue having a Zoom option for the public. We will be required to have a quorum at the meeting, physically present at the meeting. So there could be one, maybe two members that attend virtually, but we will have to have a quorum physically present going forward. But anyway, these Zoom meetings are handy because we can then publish them on YouTube. And so I believe beginning with our January meeting, they will be published on YouTube. And the reason we're doing that is just so the public can see what we're doing easily, and also we'll try to offer some information at each meeting that would be helpful to the public. We'll try to have a presentation of some sort each meeting that would be of interest to the public as well as to the board. So I just think that's kind of exciting. And of course, then right now, all of our energies are sort of put toward attracting a new executive director for the department. And we've been busy with that. We'll kind of fill you in on that a little bit later on the agenda. That's all I have for today. Next, we have presentations and reports. And the first item is response to public comments or questions from our previous meeting, and we didn't have any. So we won't have to answer anything today. Next is the COVID-19 update, and that will be by Samantha.
Okay, are you able to see the presentation?
Yes.
Yes.
All right.
Yep.
Okay. Good evening, everyone. Yeah, I'm Samantha Kloft, Interim Director at the Dubuque County Health Department. And this is just a brief COVID update on any changes that have happened since I reported to you last month. So Dubuque County and most of the United States are still at a level of high community transmission. The CDC collects this number by looking at the cases per 100,000, as well as our percent positive. And that's explained here in this first table. And as you can see, if our cases are over 100 per 100,000 people in the last 7 days, that would put us at a level of high community transmission. And then also if our percent positivity for the past 7 days is above 10%, that would also qualify us to be in a level of high community transmission. So then as you can see from this bottom table, our case rate per 100,000 as of today was 447, and our percent positivity is 13.59%. So both of those numbers are higher than the metrics given, and so that is why we qualify as a high level of community transmission. But I do think it's important to note that both of those numbers are down from the last 7 days, which is great news. The other thing I wanted to point out is that when you are in a level of high community transmission, the CDC does still recommend that anyone over the age of 2 years old who is not vaccinated or not up to date on their vaccinations should wear a mask while inside. This also applies to people who are up to date on their vaccinations if we're in that area of high transmission. So really, when we're at this level, everyone should be wearing a mask when in indoor space, regardless of your vaccination status, according to the CDC. They also recommend that there's universal indoor masking for teachers, staff, and students, as well as visitors of all pre-K to 12 schools, regardless of vaccination status as well. Okay, this is our positive cases in Dubuque County since the start of COVID-19. And as you can see, we hit our highest peak here back in about January. And we have been slowly going down from that peak ever since. If we zoom in closer on that end of the graph, just in the past month, you can see that our cases have continued to go down. We were at 211 as of today for our past 7 days. We have in our office noticed that the demand for testing supplies has gone down as well. We're getting a lot less calls to the office requesting the at-home PCR tests. And we were getting calls pretty frequently back in January, which would correlate with that spike in the previous slide. Also, when talking with our hospitals and our testing providers, they are reporting that they are also catching up on their testing supplies again and starting to have a good amount on hand, which is great to hear. As for our hospital capacity, capability, and overall data, this will continue to be reported to the incident management team and the media, but IDPH has previously collected daily hospitalization data as well for the public dashboard. As of today, this was removed from the dashboard, but I will talk about that in a little bit. The incident management team does continue to meet with hospitals on a weekly basis, though, to work cooperatively and provide transparency as we work through the COVID-19 pandemic. As you can see from the chart, today it was reported that there were 7 hospitalizations between Mercy Medical Center and Unity Point. 3 of those were 3 of those were at Finley and 4 of those were at Mercy. But previous to other slides, this is going down as well. This is our positive COVID cases by age in Dubuque County over the last 7 days. Like I said, there's been 211 positive cases in the county in the last 7 days. And of those, 18% are from 0 to 17. 17% are from ages 18 to 29, and the other 13% are ages 50 to 59. And that looks a little different than it has in previous weeks. Usually where that 50 to 59 age group is where the 30 to 39 age group is. But as you can see, 30 to 39 is at 11%, so it's not far behind. And those 39 and younger are still making up about half of all of our COVID cases in the last 7 days, which is a common trend we've seen for many weeks now. This is a slide showing our variance by month in the county. As you can see, we now have February data, and IDPH is estimating from that data that 100% of all of our positive cases so far this month have been Omicron. This again comes from sequencing a certain number of COVID tests to estimate the presence of Omicron in Dubuque County. So it is an estimation, not an exact number, but it does give us an idea of what the county is looking like, and it lets us know that Omicron is in the county and will continue to spread. The Iowa Department of Public Health is estimating that 99.2% of all positive cases in the state of Iowa so far this month are Omicron. So we're just slightly above the percentages for the state as a whole. This slide is showing our vaccination and booster data by age, and there's a lot of numbers on there. But ultimately what it is saying is that 53.81% of Dubuque County residents who are fully vaccinated are now up to date as well, which is great. And overall, 63.5% of Dubuque County residents are fully vaccinated. As you can see from this slide, those age groups that are less up to date with their booster doses are younger age groups, which correlates with the previous slide about which age groups are making up the highest percent of our positive cases. Just a note on this slide that not everyone who has completed their vaccination series is now eligible for a COVID booster. The CDC is recommending that those who received Pfizer or Moderna get their booster 5 months after their second dose of the vaccine. And for those who receive a J&J COVID vaccination, they are eligible to get their booster dose 2 months after receiving that vaccine. COVID-19 vaccination clinics continue to be available at our doctor's offices as well as some retail pharmacies. And I put the link in there to the county website where you can get a full list of all vaccination sites in Dubuque County. The Visiting Nurses Association continues to have walk-in clinics in downtown Dubuque on Mondays from 3 to 6 and Fridays from 8 to 4. We still have the Sleeves Up phone line where you can call to help navigate our vaccination clinics and schedule appointments, as well as coordinate rides to those appointments if needed. And then I put the VNA phone number in here for the COVID-19 guidance. And that goes along with our next slide, talking about our shift in contact tracing. At our last meeting, we presented to the Board of Health a proposal for a shift in focus from traditional contact tracing to increased education and staffing at COVID hotline. And so that VNA phone number is the COVID hotline. And they have a staff member there who will be able to answer questions related to isolation and quarantine. To date, since that last meeting, after this plan went into effect, the VNA has received 142 calls from the public. So that's great. People are using that hotline and getting the help they need when they need it. And then on my screen are just 2 different posters that we developed to help increase education about the new isolation and quarantine guidelines. The one on the right here was provided to our testing providers throughout the county to give out to those who come in for a COVID test. And the one on the left provides a QR code that will take you to a virtual version of the poster as well, which will help as we continue to update this as guidance may change. At the last meeting, I updated you on some CDC masking guidance, but this is just another graphic to better display the science that has been found to prove that our masks are able to prevent COVID-19, and those N95s and KN95s are the most effective at doing that. This slide just lists some additional updates from the Iowa Department of Public Health. As you all know, the state public health disaster emergency proclamation ended this week for the state of Iowa. And with that came some changes to COVID-19 reporting to the public. So there is a change in the website where you can find this testing and vaccination data, and I've linked that here. That is now on the IDPH website. It is no longer coronavirus.gov or vaccinateiowa.gov. IDPH will also no longer be requiring test sites to report negative COVID-19 test results. So that data will no longer be available on the public dashboard as well. IDPH will no longer require long-term care facilities to notify the health department when they have 3 or more infections in a residency. Instead, the Iowa Department of Public Health will be using CMS data to identify these facilities, and that data can be found on this web link here. And IDPH will also no longer collect COVID-19 related data from Iowa hospitals, but the U.S. Department of Health and Human Services will continue to require hospital data reporting, and that can be found at the link here as well. So the shift with IDPH for those last 2 points about long-term care and hospitalizations is really just because they were being double reported. So the data will still be collected and available. They just will not be available in the same way. But those are the biggest changes we see right now. The incident management team does not plan on changing how we meet with long-term care or hospitals. And we will continue to have conversations with them and discuss the situation as we move forward. We also are now having conversation about what our data reporting will look like moving forward. And today was the first day that the website really changed. So I think we'll see more in the coming weeks as we start seeing reports that don't include those negative test results and things like that. So there might be some slight shifts in the data we're reporting to the public, but I'm not anticipating anything major right now. And that was the last slide, if anyone has any questions.
I have a question, Samantha. Do you have any suggestions of where people can purchase the N95 masks? Number one. And number two, last month, or I think it was last month, we approved buying more masks to give out to the public. And I was just wondering if you have a status update on that.
Yeah, I'm sorry. I meant to mention that on the mask slide. The masks that the Board of Health voted to order came in. I have them at the health department office, and Tom Berger also has them at his office as well. So if there's any community members or Board of Health, Board of Supervisor members who are interested in taking some so they can hand them out to the public, that would be great. Just let me know. And then with the N95s, Hardig Drug received a shipment through the federal program of those as well for the public. And we distributed those to a variety of long-term care facilities and providers throughout the county. So if there's anyone in need of N95s, you can let me know as well, and I can connect you with him so that we can get those out to the public in a timely manner too.
Okay, thank you.
Sam or Sandra, this is Jess. I would just also let you know that Mercy received probably, I don't know, 10,000 of the N95s as well, and we're kind of working on distributing. So I think there's ample in the community.
Okay,
It's just a matter of getting them out.
good, thank you.
And this is Marcia. I think that the pharmacies also give 4 masks, N95 masks per person that comes up. I don't know how many they have to hand out, but I know that Hy-Vee, certainly their pharmacies have them.
Okay, good, thank you. Any other questions for Samantha? Okay, the next thing on our agenda, we are going to review our Board of Health COVID-19 mitigation recommendations. And Samantha, do you happen to have that where you could show that on the screen, our current recommendation?
I do, yeah.
Okay, and Dr. Schultz, would you be prepared to give sort of a summary or an opinion of where you think we are now and what you would recommend?
Yeah, be happy to. So I think overall we have a very positive situation that we are seeing now. And let me explain to you why. As you see on the sheet and data that Samantha shared with us, we have a significant drop in the numbers of the Omicron spike that we saw. These numbers are going down very fast, and I would almost anticipate that probably in the next days, 2 weeks, the whole color of the community transmission sheet will change to a moderate level. That's what I would anticipate. You already saw a little bit of lightening up in the middle of the United States. That was not there 2 weeks ago. So I think we're moving in the right direction. The other thing that is different, and that's why I'm very optimistic that we are in a very good spot right now, is we have, and Samantha, you correct me, we have 70% of vaccinable people in Dubuque County vaccinated. And vaccinable people means 5 and older that can get a vaccine. And what we probably now can anticipate is, after 2 years and after the real hard and heavy hit with Omicron, that we have a lot of people who had it, even if they were unvaccinated, who are now immune against Omicron. If you're immune against Omicron, you're also immune against Delta. So this is not a backward development. The other part that we also see is we have a lot more home testing. This is reflected by the fact that the testing rates go down, and I think everybody noticed that. But on the good side, that would be the important thing to watch out for. We do not see more hospitalizations, just in the contrary, we see less and less. So that indicates to me that whatever is out there from Omicron, whatever infects the whole community, is probably not as virulent as Delta and the previous variants are, which is good, because if it hits a lot of people that are not vaccinated yet, or the people that cannot be vaccinated and does not make them sick, it makes them at least immune. And if you recall our initial discussions about when is the time to really call it off, we want to get, or it would be ideal if we could get to herd immunity. And I think we are probably very close to it right now, at least in Dubuque County, if I see the numbers and if I see what happens in the hospital, in outpatient settings, where also the numbers are going down, and in terms of sickness and sick leave in the community as well. That is all going down. And why is that important? I think what this looks like to me, it looks like a bad flu year. And what I mean by that is every once in a while in respiratory virus season, we get one variant that's less pleasurable, gets more people in the hospital. And I've seen in flu years up to 15 people with influenza in the hospital. And I've also seen people die of influenza in the hospital. So that will not go away. This will also not go away with COVID. But what we see here might be how the new baseline can look. And what I mean by that is it will be a recurrence like influenza. It might come back every year. I don't think we're going to eradicate it, at least not quickly, but it might be in the way that influenza shows up. Some years are better than others, but overall, it does not hit us as hard as in the last 2 years. And I think we've learned a lot with the vaccination strategy, and I think that coined out here. And we also learned a lot about the treatment against COVID, which is also has gotten better. So I think the situation we have now compared to last year to the year before is really significantly improved. And having said that, I think it is worth, and I think it's reasonable from my opinion, to discuss how we de-escalate the mitigation measures. Now, as Samantha pointed out, the dashboard that the CDC proposes is sort of 7 days behind. You see the 7-day, transmission rate in the community, but I think this is a good benchmark how bad it is in the community. So I think I would still take a look at that as a guidance of when should we start rolling back the mitigation measures. That is a good, I think, tool for us at least to get some data-based trigger point when we say, no, I think we can roll back stuff now. The other part that we also have to contemplate is in past years pre-COVID, when we had the flu and we had people that are at risk, people with multiple diseases, COPD, heart disease, diabetes, obesity, or people who are immunocompromised, transplant patients, patients on chronic doses of steroids, we already had recommended to wear masks. And I think what we pointed out, and it's more a wording thing, but it is important. What we pointed out in our recommendations as should and require should be more like our advice to and our encouraged to. And I think that's something that we should include in our discussion. That would be my proposal. Again, I think we are in a very good spot right now. And I'm hopeful that with the warming of the weather and with more outdoor activities, and with the dropping numbers, we might have a nicer spring for a change, but I don't hold the crystal ball. I mean, this is just based on the data that we have learned over the past 2 years.
Thank you very much, Dr. Schultz. So this is our time to discuss whether it's time for us as the Dubuque County Board of Health, if we should relax our mitigation recommendations a little bit, or if we should keep them the same or do something else. So does anyone have, this is your opportunity now, does anyone have an opinion that they'd like to share?
Maybe I can start with my opinion, if that's okay.
Okay.
I think when we do these recommendations, what we have in our mind is what is the risk for members of the community? What is the risk for everybody? What is the risk for high-risk patients like immunocompromised? And I think that's where we have to take a close look at. I think the situation with the vaccination level, the virulence of Omicron, and the probably immunity level that we have once the numbers drop to the moderate level in community transmission is way lower than in the past 2 springs when we had COVID. And I think by now, everybody who could have gotten vaccinated could have gotten vaccinated. So if you choose not to do this, it's a personal choice, and you and probably you alone will bear the risk of what can happen to you if you get the virus. And if you are unfortunate to have a more severe course that leads to hospitalization, or intensive care stay. But for everybody else who had the virus, who is vaccinated, the risk, in my opinion, becomes less and less dramatic and less severe.
Thank you, Doctor. Anyone else have any comments?
I have a question. It's Marcia. So Hendrik, what are you suggesting that we then do? Do we alter our recommendations as printed, or I agree with everything you said. So, but what are your recommendations?
So, I mean, there are a couple of levels here. There's a level that goes to, that concerns federal regulations. So we cannot tell a hospital how to do it because it's regulated differently. We can probably also not tell any federal or government organization how to do it because they do that on their own. But we can decide what we recommend in Dubuque County. And let me give you an example. What we have recommended here is fully vaccinated people should wear a mask in public indoor settings in areas of substantial or high level. If this goes down, this is something I think we can take off for now. Does that make sense? So I think the initial strategy that we discussed 2 years ago was mitigation measures are a very flexible tool. It's a flexible response that you intend. We have a time now where we probably, if the transmission levels would go down to less than substantial or high, where we could say, okay, if you're fully vaccinated, you do not need to wear a mask indoors anymore. But for somebody who is immunocompromised, they can still decide to do this. And we can also say, okay, for businesses, they can offer masks, but nobody is required to do this because the risk is significantly lower than it was a year ago or even 6 months ago. These are things that we can put in there as guidance. And remember, we only have the authority to make recommendations. The final decision, what is done in the county, and the final responsibility is with the county supervisors, if I'm not mistaken. So what we did with this recommendation at the time that we made it was practically following the CDC advice. And it's not necessarily verbatim, but it is pretty close to it. But what we can do now is we can at least give a guidance and advise our county supervisors where we think the level of risk is. And if they feel this is a recommendation they would like to follow, they can do this. But we can outline the wording and the assessment of the risk.
Dr. Schultz, just to move this along, would you want to put that into motion form?
I can do this. I would simply, if I go quickly through the document, I would leave the first line: unvaccinated above the age of 2 are advised to wear a mask. Fully vaccinated people are advised to wear a mask. Wearing a mask is most important if you have a weakened immune system. I would leave that because that is still valid. Fully vaccinated people who have come into close contact, I think that's still valid if we update it to the current CDC guidelines. I think teachers, staff, and students are advised to wear a mask. At the end, I think this is also a school district decision. We still recommend or advise in private businesses that people should be encouraged to get vaccinations if they're eligible. And the same is true that private businesses in Dubuque are advised to use masks if appropriate for staff while working in person. Again, this depends on the risk level. For the Dubuque County staff, the same wording: we do not require, we advise to or encourage COVID vaccination, and we recommend still the same. And for the Board of Supervisors, we also advise mask wearing for all staff, depending on the transmission level. I think that's the part we have to include now. The condition for the change in the mitigation measures is the drop in the transmission level to have some sort of objective criterion. And I think the CDC has given us the numbers. What was it? Below 10%. and below 100. Once we hit that mark, I think we can say that would be a time when it makes sense to give it a try to roll back the mitigation measures. That would be my proposal. Sorry, it's a little bit long.
Right. Did anyone take notes about that motion? Or do you have our recommendations marked up, Hendrik, that you could share with us later after the meeting?
I have it in my handwriting and you could not read that.
Okay.
But
all
I
right.
can
Sandra,
put
I
it.
tried to take notes
Yep,
and Hendrik,
yep.
I think, let me know if this is what you're saying. Some of those
Yep.
sections need to be updated to match the newest CDC guidance.
Yep, correct.
Add in words like advise rather than should.
Yep.
And then include that when we leave a level of high community transmission, these would be rolled back. Is that correct?
I think the way I would phrase it, the way I would word it, I would say if the levels are continuously going above a moderate level, we have to have a meeting or have to have a discussion about putting them back in place. I think that's a reason.
Moderate.
I think that's a reasonable addendum, Samantha, that we should include in the motion.
Okay. All right, Samantha, thank you for catching that and taking notes on that motion. Is there a second to the motion to modify our recommendations?
This is Marcia. I would second the motion.
Thank you. Now's the time for discussion. Please tell me what you're thinking.
I think these are good recommendations, especially with the pandemic fatigue that most people are feeling, that this kind of, again, is a light at the end of the tunnel, much like vaccinations were a year ago for all of us, that again, we're seeing that we might be able to get back to a more normal, a new normal lifestyle. And so I thank you, Dr. Schultz, for coming up with this wording. I like the recommend instead of require. I like, or advise. I like those words.
And again, we are now in a situation where we don't exceed our resources anymore. So that's also a part where I say the risk is lower. That was not the situation last fall and also not in the fall of 2020. Now we can handle it like we could the flu years in the past.
This is Marcia. I have a question. I believe the school system is using the 3% threshold before they require in-class masks. What does our, I can't see that part of, what does, oh, here, I see it. It's right in front of me. How does our recommendation handle that? They use a 3% threshold.
I mean, again, at the end of the day, it is a decision that the school board has to make whom they want to follow. In the current situation with the numbers declining so rapidly and people probably having had it for the last couple of weeks, maybe even without noticing, and if you don't get tested or you don't test yourself, you don't feel sick, you never know if you had it, but you might simply had it at that point of time because it was so contagious. I think the risk is relatively low. Now, again, having said that, if you have special students with special needs, immunocompromised, high risk, you have to find it, or I would recommend to look into an individual solution to keep them safe. I think 3% was a reasonable approach, but I think, again, the school board can also decide how they want to handle this going forward. We did not see, and maybe to put this information also, to put this into context, fortunately, very fortunately, we did not see many cases, pediatric cases with COVID during the time since we discussed this last. That was something that was the great unknown that we had, but fortunately that never materialized.
Okay.
And we're recommending putting the term suggest or recommend rather than require.
Yep.
Correct. Right.
And this is Adam. I really like that wording as well.
Thank you, Adam. Are there any, does anyone see any like unintended consequences of us doing this? I mean, is it a good message for the public Are we going to give them the wrong idea that, hey, this is all over, we're finished? Or I guess another idea that I had, if we make these changes and it's going to be sort of a personal choice, whether you wear a mask, maybe we also provide some guidance. If you're an older person or immunocompromised as we have in there, and you're going to indoor event and you don't know if people are vaccinated, maybe you should wear a mask. Just that kind of guidance. I don't think it has to be part of our recommendation, but maybe we can work on that next month. Jess, do you have any suggestions, or Tom?
This is Jess. I guess I feel like we still kind of do say that, Sandra, in the second bullet, kind of sub bullet there. If you have underlying conditions, if you're at increased risk,
True.
that safety precaution never goes away, regardless of, you know, I mean, even during flu season, we would say that. So I like it, you know, with the suggestions that Dr. Schultz made. And again, I want to echo my gratitude for your work on that.
I have one other suggestion based on what Sandra just said that I wanted to throw in for discussion. One of the strategies that works also to mitigate risk further for the individual and also for groups is testing yourself with the kits that you have. This was an option that we did not have before, particularly not in 2020 and also not until long into 2021. It might be worth putting something in our recommendations, such as if you attend large events, for example, family gatherings, consider testing yourself before to minimize risk for others and for you, or communicate with others. I mean, that is a strategy that has been shown to work in other countries where they, for example, with big gatherings, music concerts or family events, where they simply said, let's just get tested before. It's not 100% guarantee, but it minimizes the risk further. And it worked out. The infection rates were way lower if you follow that strategy.
Okay.
What I read lately is it's probably as effective as not going to the event, which tells you a lot. So just put just a recommendation like this in. Please consider self-testing or recommending testing or talking about testing with friends and family if this is an event to minimize risk further. That would be a guidance I would offer.
Okay. So Dr. Schultz has, I believe, effectively amended his motion to add that, correct, Doctor?
Yep, that's fair.
Okay. Tom, any comments?
The only comment I have is, do we think it's necessary to put some language in the beginning of this that says, as we see the transmission rate continue to decline, we're changing our recommendations, but if that turns around, we need to reconsider. If we go on and we're in the moderate transmission rate for another 3 months, and then we turn red again.
Yeah.
Right.
Do we? Yeah. We really should get back together.
Yeah. So I'd like to answer that unless somebody else wants to.
Go ahead, Doctor.
So, Tom, what we might see in the years to come, and probably also the next season, not next or coming October, September, November, December, and so on, is we will still go up in the red transmission zone. We will still have this pattern that we are seeing right now. What is more important than that is actually the level of medical services we have matching this. If all it takes is stay home, then it does not really matter if everybody is in the red zone. We see this for the flu all the time. Now, why would that matter for this document? It matters in so far because when we see this, we don't want to have emergency meetings every year about a recurring event like the flu that does not really cause a large scale problem like the past 2 years COVID caused. So I think putting that language up front, and maybe also what I would suggest, Tom, following your suggestion, is to say we will reevaluate this in, let's say, 6 months before the next flu season starts, to see if it still makes sense to keep it in place, or whether we can say we just go to whatever is recommended at that point of time and follow with what I would call like a usual care, usual practice. I don't know the answer to that yet, but at least it would put a stop in for us to say, let's reflect for a second in 4 to 6 months. Do we need to keep this, or can we actually say, no, we will just follow now the IDPH or CDC guidelines as they are out because they work and because the risk and transmission rate is so low?
So do you think we're ready to take a vote on this? Does
Could I
everyone?
make-
Go
Could I
ahead.
make, do we need to add any language regarding a recommendation for people to get vaccinated or maintain kind of current vaccination status? For example, get their booster when eligible? I don't know if that's been discussed previously.
So the recommendation we have in there, I think it is a good idea just to add on with the recommendation in general and keep your vaccination status up to date, something like that. I think that's a good idea.
Okay, so that's a friendly amendment to this motion. Is that okay, Dr. Schultz?
Absolutely.
Okay. Okay, let's go ahead and take the vote on the motion to make some revisions to our mitigation recommendations as stated by Dr. Schultz and as amended. Everyone in favor of making the modifications, please say aye.
Aye.
Those opposed, please say nay. Hearing none, then the motion passes. Thank you, Dr. Hendrick.
Thank you,
The
guys.
next item on the agenda is Board of Health member topics of interest. And tonight, Adam Hoffman is going to present. And Adam, I'm sorry, I know that we now only have about 10 minutes left in your
That's all right. I don't think
time.
it'll take long, Sandra.
Okay, he has to be someplace else at 7 o'clock. So go ahead, Adam, with your presentation.
Yeah, thank you. And good evening, all. So I'm just presenting a little bit. Sandra and I, in our new roles, had a chance to sit down with Samantha as well as representatives from the Iowa DNR, and had a really fantastic dialogue. And I think they nicely showed us some opportunities that we could do to take advantage to really increase public health, especially as it relates to some of our environmental standards and work with environmental stuff. So one important thing is we have an opportunity to update our well and septic system ordinances and policies. So that's an area that we can really improve public health. And with that, we plan on holding some contractor meetings, or Bailey will hold some contractor meetings and do some trainings related to that. And then certainly interact with other counties to see what they're doing in terms of ordinances and policies. And really, we think we can make our water quality a little bit more robust using some of these opportunities. And then we also realize that we have opportunities for public outreach, both with our grants to counties testing. That's a fantastic program that allows folks on well water to get tested once a year at no charge to them. And they've started a nice public awareness campaign. Samantha's helped with that in terms of getting the awareness out. It's a great opportunity for county members, and it's a great resource, as well as just in general environmental health and public health. So really doing a better job stressing the importance and the role those two kind of play together, the dual role there. And actually former Board of Health member Diane Pape Freiberger brought to our attention that the Mississippi River Museum is having a party for the planet. And now the Public Health Department is in talks to attend that and do some good things related to environmental health and public health in that relationship. So I think there's some really good ideas and some good frameworks and structures moving forward where we can do a good job of spreading the good word of what the health department is doing, as well as how environmental health plays an important role. And then also talk with Eric Schmeckel and some other folks about making a little bit more robust the collaboration between the county watershed department and the county health department in terms of cross trainings, just collaborating a little bit more. There's lots of overlapping ideas and really some stuff that we can do there to improve. So we just, really kind of started discussing ways we can do a better job with environmental outreach and kind of improve our public health through environmental improvements as well. Is there anything I missed, Sandra, or anything you would like to highlight there?
I think you covered everything. Thank you very much for doing that. And I do think that that is an area of the health department that we can grow and really improve. I have reached out to our district representative, Becky Nowacek, who is the district representative for the Iowa Department of Public Health. And she's going to obtain some other counties' ordinances that are up to date, if she can, just so that we can have a little bit of a guideline when we start that work. And then we're also kind of looking for people, other counties that could be sort of a resource for our health department, so they can have somebody they can ask questions of and that type of thing. So Becky Nowacek is working on getting us some resources there. So I really appreciate her help.
And then I should also stress that Samantha and Bailey have been doing a wonderful job in implementing stuff as well. So they've been very receptive to all this too, as you know, Sandra.
Absolutely. Thank you, Adam. And
yes, thank you.
Go Rams, right?
No comment.
Okay.
Thank you.
The next item on our agenda is a guest presentation concerning the open meeting laws. And I believe Dawn Sherman from the Human Resources Office for the county and Attorney CJ May, the county attorney, are going to give us just a little talk about just reminding us of how we can meet the requirements of the open meetings law. And you can go ahead, CJ May and Dawn Sherman. Thank you very much for being here.
Thank you.
Yes, thanks for having us. I'll just kind of start off here real quick. About 50 plus years ago, the Iowa legislature enacted what's entitled the Official Meetings Open to Public Law chapter in the Iowa Code. It's commonly referred to as the Open Meetings Law. If I have this right, I think there's over 65 cross references in the code sections to the open meetings laws. So it's very widely used. And I think one thing to bear in mind about the open meetings law is it's one of the few, I think, statutes that by law, it has a specific and stated intent. And just real quick, if I could read that, because I think as we kind of work through this real quick, we can kind of circle back to this. And it says, this chapter seeks to assure to a requirement of open meetings of governmental bodies that the basis and rationale of governmental decisions, as well as those decisions themselves, are easily accessible to the people. Ambiguity in the construction or application of this chapter should be resolved in favor of openness. So that was language from over 50 years ago. I think a more common word might be transparency, right? There's basically 4 elements to the chapter. That is, you need to have a governmental body, which is what you are. It applies to all of your meetings, which would be, in short terms, basically a majority of your members, where there's going to be some deliberation or action on a matter that is within the scope of your decision-making and policy-making duties. You would have to have public notice that would have a tentative agenda. And then at the meeting, you have to, of course, keep minutes of all the activity that's going on. What's really important is, I think, the openness side of this, because if there's ever a question about what you've done or not done, it always circles back to, was it open, right? Did people have access? Did people have notice? Did people have prior knowledge? Fundamentally, I think as you move forward through all these things, you constantly are going through all of these steps each time you have a meeting, and you're taking your minutes and documenting those things. I don't believe that you have too many closed sessions, but those are very specific, and there's a very specific process you have to go through to get into a closed session and then to get back out and then to put that on the open record, if you will. We really kind of, we're always here to help, of course. I think one way to, in my opinion, to not violate the open meetings laws would be to have any kind of a meeting of a majority of you where you start to talk about a matter that's within your jurisdiction that you fundamentally take some action on. And there's been cases, there's been, case law, if you will, where, things have been circulated kind of through a messenger, one by one to a majority or more of the members of the governing board. And then collectively the decision is made, maybe in the open meeting later on. Another problem is when people send emails amongst all of themselves and then they start talking. And that's a very, very dicey area because that can be considered deliberation. So it's sort of a gray area between just some very harmless, innocuous, like, oh, hey, I found this article, why don't you take a look at that? And, oh, I saw that, what do you think about this? And maybe we should do that. So, you can kind of go from something very, very, very honest and innocent to sort of a problem area. And, unfortunately, there's no real book on a shelf that we could give you every single example of what those would be. But I think, kind of practically speaking, if you are always just very cognizant about, it's fine to share something, but that's really where it needs to end. And then you need to bring back the discussion to your open meetings when you actually have your meetings based upon the notice, the agenda, et cetera, right? So I'll stop there. I'm the lawyer, of course, I'm going forever. So that's why I think it's nice to have Dawn because she's way shorter than I am.
Thank you. Thank you, CJ Ray.
One thing, with the emails and just documents and, how we transmit information is one thing. If it's something that's under the purview of your authority that you think is of interest to the entire board, I would recommend forwarding that to your chair as she sets the agenda for your next meeting. She can just put that as a communication piece on there. So you'll all receive it in your packet. That way it'll be on the agenda if you'd like to discuss it. Or you could just receive and file it. And that way it's out there in the sunshine that everyone knows how you received that information. And again, gives you an opportunity to discuss it if you choose to.
Dawn, I had asked you a couple of questions earlier today when we were talking. For instance, it would be a violation if I sent an email to 2 people on the board, and then I sent the same email to 2 other people. Just because I split up the email doesn't mean that I'm abiding by the rule. So that's something I can't do, correct?
CJ's shaking his head yes. I think he alluded to that in some different terminology.
That would not pass muster.
Right. And then and then if somebody does send out some piece of information, if they do it that way, and if we just don't comment on it, that probably would not be a violation, correct?
I would agree. Again, just the sharing of a document or information, and it just stops at that level, and then you take it up at your meeting.
Right.
That's appropriate. Yes.
And we would probably even recommend don't say thank you or anything. Just leave it at that.
Well,
to be real strict. Yeah.
Every now and then, there's some of the cases when you read those, they get down into kind of, well, what was a person's intent? Like, we're trying to do this, or was it just some sort of a harmless error? I think, and I would hope that we can still be cordial and say thank you.
Yes, true.
And
then, but we can discuss amongst ourselves. So like Amy and I can meet for coffee and we can talk about things that are within our purview, correct? 2 people, even 3 people could get together and talk, but we can't have 4 people meeting and
Cannot-
talking.
Quorum or a majority, that's right.
Right, right. Well, I appreciate that clarification. We have had two members that had to leave at 7 o'clock, Dr. Schultz and Adam Hoffman. But we do still have a quorum here. We have 1, 2, 3, 4, 5 members still present. Do other members have any questions about the Open Meetings Act?
Yeah, I mean, yeah, we'll certainly answer them. While you ponder that, perhaps one thing sometimes comes up is, what if there were 4 or more of you at, say, a Chamber of Commerce event or something, right? Is that considered a meeting? And the answer would be no, as long as you're not discussing a matter that's in your policymaking purview and taking action or deliberation. So, having said that, yeah, they need to be careful, right? Because there literally has been cases where people have heard people talking in the, you know, in the foyer, and they say, well, I heard them talking about that, right? And I heard them say, yeah, we'll take that, we'll go work on that on Monday then. And so you know, now you kind of get that taken out of context. And so, but as long as it's some ministerial appearance that you make, it's okay. You know, being visible is good,
Okay.
but you just need to be mindful of, you know, being together like that.
Right. Like, for instance, the VNA is going to have an open house coming up, I think maybe next month. Many of our members, I mean, there might be a quorum that happen to attend that open house. But we just have to be very careful and not discuss any business, basically. Correct?
Yes, absolutely.
Okay, any other questions?
Just one comment, Sandra.
Yes, Tom.
I know that emails go back and forth, and I think one of the biggest violators, or one of the biggest things that can get us in trouble, is using the reply all. This reply, if you want to reply to one person, don't discuss it in email with the entire board.
Good point, Tom. Thank you.
Sandra,
Well,
I
thank you.
think,
Go
I
ahead.
think Supervisor McDonough had a question about formal subcommittees and how those kind of play in.
Oh, I'm sorry. Go ahead.
No, it was just in the chat.
Oh, okay. All right.
So CJ, there was a time when this board had 5 working subcommittees. And when those subcommittees met, they were on the calendar and they were required to post a formal open meetings notice. There weren't a majority of anybody. There wasn't a majority present. But can you walk through that? Because I do think that this group's probably getting to the point where that might be something they start looking at in the future, to have, you know, subcommittee work as compared to informal coffee. How would you view open meetings with formal subcommittees?
Well, that's a good question. And, you know, I kind of didn't really hit that one too hard before tonight, but the subcommittees would be handled the same way that the committee. So if the subcommittee is 5, if you have more than 3, they will apply. Where it gets a little tricky is if you have a meeting of the subcommittee that they, you know, let's say you have the meeting of your whole board and then the subcommittee breaks off while the main board recesses, for instance, for just to allow for that. You need to be very careful about, you know, following each agenda and the notices for that. So, so I don't know, John, do you have, I mean, does that strike you any differently?
You know, the only experience I had is we had an issue with that when we had an ad hoc committee that was created by the Board of Supervisors. That was for the ATV discussion. And the guidance at that time was, it was a different county attorney, and his guidance was to post those as a public meeting. And, you know, it was an ad hoc, I would say, working committee who was going to give recommendations to the board on a subject under the authority of the board. And so at that time, you know, that was his guidance at that time, was to make those public, open to the public. And we did publish agendas for those as well.
This is
So-
Tom Bashan.
Yeah, go ahead, Tom.
I recall back when we had those committees, one of the committees was our substance abuse or opioid committee. And what happened there was we had a subcommittee, and it was normally 3 people or less, so we weren't in violation of the majority rules. But what was happening is more than one member of the supervisors would appear at our meetings. So with that being the case, the supervisors were in violation of the open meeting law because they participated in the meeting. So because of that, at the supervisor level, we had to comply with the open meetings. So I'm not sure that for us to have 3 people on a subcommittee requires us to post meeting notices and agendas. It's when the broader things happen where another group may have a quorum.
That, Tom, if I might, that happened once, and that was not known in advance. And so when we show up together, according to the auditor, there are different rules that supervisors also need to apply by. Those opioid meetings or subcommittee meetings were chaired by Todd Lang, a member of the Board of Health. He called them, he posted them in advance, and they were held on a routine basis once a month. And those were always open meetings. Otherwise, you're working on opioid issues, substance abuse issues, not in the sunshine. You're not giving anybody in the public the ability to join, listen, and we did have members of the public who came to those meetings. I try to attend every month myself. So that's where you can have a standing committee, like when you did for your face mask debate, right? You had a standing formal subcommittee that was working on a specific issue. You have to post that as an open meeting. Otherwise, it's not just 2 people having coffee. It's the business of the Board of Health being done in a fragmented way for a very specific purpose for a length of time. Those meetings were several at a time, perhaps on a project basis. That's the nature of being a governmental board. So I would say that that is a necessity, that those go through the posting requirements and that there be minutes taken.
Well, I guess I'd like to hear from CJ on that, and I think he's ready to, but you know, it was my impression that that committee was a subset of the group bringing a recommendation back to the board. It was the board as a whole that acted, not the committee. So CJ?
You bet, Tom. So I think the answer to this is if you have a formally constituted subunit, that's how it's defined, of the parent governmental body. So in this situation, if the Board of Health would be the parent governmental body and you have a formally constituted subunit that you've, again, let's just say it's the opioid subcommittee, all right? If they have a meeting during your meeting or during a recess of your meeting, that has not exceeded 4 hours, or if they have a meeting immediately following the parent governing body meeting, then there is no separate notice on agenda as long as the meeting of the subunit is publicly announced in open session at the meeting of the parent group, right? And that the subject matter of the meeting reasonably coincides with the subjects discussed or acted upon by the parent governmental body. So as long as they're discussing something that's fundamentally on your agenda and that you're discussing, they can go meet during your meeting, during a 4-hour recess, or immediately after, if it was publicly announced during your meeting that they are in fact meeting at the same time or during the recess or immediately after, and as long as it would coincide what you talked about. I think anything outside of that, Tom, they have to have a separate agenda and they have to have separate notice. And I can appreciate the kind of the clunkiness of that, but you know, when the day is done, what this always tries to accomplish is to let the public know what these governmental units, governmental entities, or the subunits are doing, when they're doing it, and what they're going to talk about.
Okay.
Yeah.
I have just a question about what we're doing right now as far as hiring the new executive director. We had a group of 3 people from the board that we worked with Dawn in revising the job description. We did not, that's not a formal committee.
No.
It's just a group of 3 people joining with Dawn to get that work done. That doesn't apply then, correct?
No, that would not apply. That was
Okay.
not right.
And now going forward, we're going to have some more meetings with Dawn Sherman to choose the consultant that's going to help us with our search. And we're going to be talking about that tonight, but it may be the same 3 people that worked on the job description. Again, that's not a formal committee. We're just trying to do some administrative things to get the job advertised, basically. So
Sure.
again.
But I would say this, Ms. Larson, I think when if you're going to take, now that's going to require an expenditure of some funds or some, that's a matter that would need to come back to the full board here for consideration and action capacity.
Right. So like if we were thinking of interviewing 3 consultants and then making a recommendation to the board. These are the 3 that have been interviewed. This is our first recommendation, second recommendation, third, something like that.
Yeah.
Again, would that have to be an open meeting when we are having those discussions with the consultant?
Not amongst the 3 of you or with Dawn, no.
Okay,
But then you would just bring that back, put it on your agenda, right? Send out the
Right.
notice.
right.
And have your
Okay.
open discussion here.
All right, that clarifies some. Thank you.
Good.
Thank you, CJ.
You bet, Tom. Thank you.
Yes, thank you, Mr. May, for coming. We really appreciate it. And we may be contacting your office again when we start working on the ordinances.
Yes, that's a good idea. Yeah, I think
Okay.
absolutely. I'd be happy to help. You bet.
All right, very good. And thank you, Dawn Sherman, for all of your help and all the information that you shared with us tonight. And I think you're going to stick around to talk about the search. So thank you very
Absolutely.
much. The next matter on our agenda tonight is an action item, and it's to receive and file the 2021 Dubuque VNA Annual Report. By, let's see, Samantha, who is presenting this?
This was not set as a presentation. Stacy Killian is on if you'd like her to present any part of it, but I assumed it was just a receive and file because it was
Okay.
included in the
So
agenda.
you've received it and it's going to be filed. We don't need to see it, is that correct?
Unless you want to, but yeah.
Okay. I mean, I would prefer to see the report. I mean, at some point, what do you feel, rest of the board members? If we're going to receive and file, we should probably see it, right?
Was
I
it
agree.
included in the agenda packet?
Yes,
Or
yes, it was included.
It's in the meeting packet?
It's in the meeting packet.
Okay,
Oh,
that meets that requirement then. The next matter on the agenda will be discussion and wait a minute, going back to action items, do we need a motion on that, Tom?
yes, I would make a motion that we receive and file the VNA report.
Okay, is there a second?
It's Marcia, I'll second the motion.
Thank you. Is there any discussion concerning this? Hearing none, then I'll take the vote. All those in favor of receiving and filing the 2021 Dubuque VNA Annual Report, please say aye. Aye.
Aye.
Those opposed, nay. Hearing no nays, the motion passes and we will receive and file the report. The next item on the agenda are discussions and inquiries, and the first one will be a short update by Samantha from the Health Department. Go ahead, Samantha.
Thanks. Yeah, Sandra had just asked that at these meetings, I give an update on what our health department has been doing since the last time we had met. So I just jotted down a few things. And I'll start with the environmental specialist, Bailey. In the past month, since I met with you last, she's done 20 water tests in Dubuque County for the Grants to County program, which is a pretty good number considering winter. The numbers will definitely increase in the spring and summer, but I think 20 is a pretty good number for the past month. She's also working right now on the Iowa Infrastructure Fund, which is through the Iowa DNR and the American Rescue Plan Act. And with that, they announced that they were going to provide funding for certain individuals to replace their current septic system for free through the ARPA funds, if they're eligible. And so Bailey is working with those who are identified in Dubuque County as eligible to get them through the application process. She's already been in contact with 7, but there are quite a few who are eligible. So that will be a big project for her. As Adam mentioned, she's also preparing for a spring contractor meeting, and this will be to update the contractors in Dubuque County on Bailey's requirements as an environmental specialist, because she is also relatively new to her position and has yet to have a conversation like that with the contractors. So the goal of that meeting will be to get everyone on the same page about what the health department expects from septic and well installing companies and contractors this spring and summer. And then she continues to seek out additional training. She has booked trainings for septic up to the limit that she was allotted through Grants to County, and she's now looking for well trainings, if anyone knows of any. That's all I have for Bailey, if anyone has questions. Otherwise, I can move on to the office clerk. And with her position, me, Sandra, and Tom did present our budget to the Board of Supervisors. And at that meeting, we were able to get our part-time office clerk position bumped up to full-time, which is really exciting. We really appreciate any staffing help that we can get right now. So we're happy about that. But Laura has been with us for just over a month, and she's been a huge help. So far, she's helped with filing away many of our outstanding septic permits and well permits. She's helped organize a plan for payment and processing with our public water supplies, as well as a system for how to approve our liquor license requests moving forward. And then she's also been going out with Bailey every Tuesday to do those Grants to County water tests. And that's one, so Bailey has someone to go with her out in the community, but also to help Laura learn more about what Grants to County is and how the water testing process works. So then when they return to our office, Laura has also been in the process of undergoing lab orientation so that she can ideally get certified as a lab water test analyst for our Dubuque County lab and help even further with the water testing. And then just some general updates. Like I said, Tom, Sandra, and I did present our budget to the Board of Supervisors. And with that, we presented our ARPA proposal for additional staff, and it was well received. They're going to have continued conversation over the next few weeks about what that will look like. The supervisors were very supportive of our health department, getting more staff and sort of restructuring and planning for what those staff members will do. But they have yet to have a conversation about the funding source for that. So I will keep the board updated. I have also been finding more time to get involved with things outside of COVID. For example, I've been attending meetings for the Wellness Coalition in Dubuque County, which is a group of healthcare providers and community organizations that meet to kind of share ideas and share events in the community related to public health. So if there's any board members interested in joining those meetings, they're held on a monthly basis, and I would be happy to invite you so you can learn more about what's going on in our community or even provide information on the organizations and the work that you're doing too. And I've also been meeting with Stacy Killian at the VNA to establish a stronger connection between Dubuque County Health Department and the Visiting Nurse Association. And that is ultimately to better help each other and collaborate what each role is doing and how we can communicate that together to work more effectively and provide resources in sort of a complementary way to Dubuque County. I'm also working through our service area to bring tabletop exercises to Dubuque County in the next few months related to emergency preparedness. So that's exciting as well. We haven't had one of those in a few years because of the pandemic. And then, like Adam also mentioned, we're continuing to look for community events, especially as we're getting into spring and summer, that we can get more involved in and attend and show our face and get Dubuque County Public Health out there. So our first one will be the Earth Day event at the Riverboat Museum on April 23rd. But I think that's all I had for an update. Sorry, that was kind of a lot of information. So if anyone has questions, just let me know or email me anytime too.
Thank you, Samantha. You guys, are you working more than 8 hours a day? Goodness sakes, you're doing a lot of work, and we as the board really appreciate that. Next, did Stacy want to give an update on the Visiting Nurse Association?
Yep, she's on here too.
All right. Hi, Stacy.
Hi, everybody. Thanks for giving me a few minutes to kind of update on what's been going on with VNA. I have to echo you, Chair Larson. Sam is doing a wonderful job. Her and I have met pretty routinely, and so she could get to know VNA better too, and just find a more structured way to work together. So I'm really excited on some of the ideas that we've come up with, and I'm super excited for the opportunity for the board to come to VNA, learn a little bit more about what we do, meet some of our staff members, tour our facility. So anything outside of COVID, we get excited for these days. So I do have some updates of just kind of what's been going on with some of our programming that we're subcontracted for, and then just some general VNA agency updates as well. So the first thing, earlier this week, we received the results for our 2021-2022 childcare immunization audits. So for those of you who are not familiar, the VNA does do those audits in the fall. We do them for both the schools and then also the childcare centers here in Dubuque County, so we can take a look at where our immunization rates are and how they fall. So for the childcare centers, we do only do a certain percentage every year. We do not do every single childcare center, but to try to get a good snapshot of what's going on in our centers. So this year was a little bit different. We typically have several months to work with the centers and the schools to get these scheduled, give us time to review all the records. This year they shortened that deadline considerably, and instead of going through December and January, we had to have them all completed by the end of October. And knowing kind of where our community sat in October, we were very much hit hard with COVID at that time. So it was a pretty difficult task to meet that deadline, but we did do it. We reviewed a total of 1,378 records within our child care centers. Of those, 95% had immunization certificates. 1.23% had provisional certificates, meaning that they've had at least one dose of a required vaccine. They may not have completed the series, but they've had enough to be able to be there and give them additional time to get caught up. None of the centers had any medical exemptions this time around, and 2.03% had religious exemptions. So all in total, 98.48% had valid immunization certificates, which I think is a really good number. 1.52% had invalid or no certificates. And so, you know, there's always definitely room to improve. And when I submit my next written Board of Health report, I will put in a kind of a comparison of when we've been here where we've been the last couple of years. So I know we had an immunization subcommittee. Diane Pape-Freiberger worked really hard on that committee to try and get more of our providers to enter into the immunization registry. COVID helped that along quite a bit. And so I think that's where we're seeing such, you know, good numbers. I think, you know, having that high of an immunization rate is wonderful considering what we've been through over the last couple of years. So I was excited to share that. Another thing, we recently on January 11th, we had our public health services audit. It's an on-site audit that happens every other year. Becky Nowacek, our regional consultant, will come up to do this audit. And what she's looking for is kind of a lot of things. She takes a look at our billing, our patient records, VNA's HR policies, our employee certifications and background checks. making sure our agency policies and procedures meet Iowa Department of Public Health standards, and then looking at quality improvement initiatives as well. So Sam was able to join us on that audit, and she went through all of the records. We submitted a lot virtually, and then she came down in person to review the results. And I'm excited to say we had no deficiencies. We met all the standards from Iowa Department of Public Health. Becky will be submitting a letter that will go to you as the Board of Health, stating her findings and things like that in the next couple of weeks. So very excited about that. It can be a little taxing to get all the information together, but knowing, we've got those standards in place really, are really exciting for us. Our most recent grant, our community partnerships for tobacco prevention and control that we recently started subcontracting with you, that began July 1st. We've been working pretty diligently on this grant. Right now, we're currently working on an advertising campaign, looking at putting up billboards, engaging more employers, and then individual people as well through this program. So we're excited at where we are partway through the grant year. And the new RFA was just recently released by Iowa Department of Public Health. So we are currently working on that. It is due March 23rd, so coming up here in a few weeks. So we've been working with Samantha and some of our staff, which Vicki Gassman leads that program at the VNA. She does a fabulous job. And so I'm excited to see what new initiatives we can come up with to expand that program as well. So we're really excited there. As an agency, just a couple updates. We've had some staffing changes over the last couple months. Kelsey Hill just recently started. She is our new child care nurse consultant. She is fantastic. I can see Jess shaking her head. She is fabulous in that role. She is working with our child care centers on health and safety and nursing initiatives. And she works really closely with Dubuque County Early Childhood and also Child Care Resource and Referral. We have Christine Miner. She is our new Hawkeye Outreach Coordinator, started a few months ago as well. And Jane Pickle actually started probably closer to the fall. She became our new RN at our office that works with communicable disease. So she is doing currently the primary nurse for communicable disease follow-up here in the county. And then she's worked very closely with a lot of our staff that are providing some of the COVID mitigation and kind of leading that as well. And she's doing a wonderful job there too. We also have a few internal initiatives that we're really proud of and just kind of wanted to highlight. One of them is we're really focusing on diversity, health, equity, and inclusion. So we have implemented an internal DEI committee that is made up of our staff that is looking at our programs, our agency policies, and looking at how we can improve diversity internally. We're really focusing on educational materials we're giving out to patients, agency signage, staff education and trainings. And then we're also participating in the Unity Point DEI committee through their corporate level, which I think gives us a lot more resources and ideas that we can expand here internally at our agency. And one of our other new initiatives that kind of falls along with that is through our maternal health program. We are one of 4 pilot projects for a doula project through Iowa Department of Public Health Maternal Health. And basically a doula is a trained non-medical professional that will provide continuous emotional and physical support to a mother before, during, and after childbirth. And this doula project was actually developed to reduce inequities in maternal health among African American and Black identifying individuals in Iowa through expanding and modifying some of Iowa's maternal child health service delivery systems. So we've really gone off and running. We already have 2 doulas contracted. We're in the process of meeting with a lot of our medical providers on this, and we have a max of 5 individuals to enroll for the year, and we already have 3 enrolled. So we're super excited. Looking at the other 4 pilot sites, we're a little bit beyond a lot of them. So we're really excited on that coming as well. So aside from COVID, we're continuing with our, community calls and vaccine promotion. We are keeping an eye on the news and the potential of expanding the vaccines to children 6 months to 4 years of age. As soon as that becomes available and approved, we will certainly be adding that into our mix and giving that out as soon as we are able. So we are kind of watching that, providing as much information to our staff as we can to be ready to go once that does get approved. So we're staying pretty busy, but I love the fact that things are a little slower in COVID world, and we can really focus on a lot of other great initiatives we're providing through our office.
Thank you very much, Stacy. We really do appreciate everything that the VNA is doing. Are there any questions of Stacy before she signs off? Well, we look forward to coming down and visiting the VNA when you have that scheduled. So we'll see you then.
Thank you.
The next item is an update on the hiring of the executive director for the executive director position. I'll start, and then I think Dawn Sherman will jump in. But we did submit the request to the supervisors for the requisition, I think it's called, for the position. And the supervisors did pass that or at their last meeting. So that step is completed. We are excited about finding a consultant to help us with the search. And Dawn Sherman is going to help us find that consultant. And I also reached out to our Iowa Department of Public Health representative, Becky Nowacek, and she will let us know if she finds one. She's checking with all of the different counties throughout Iowa to see if someone has used a consultant that they would recommend. The next step is that we need to come up with some questions to ask the consultants. Once Dawn Sherman gives us kind of a list of possible or potential consultants, then we will be interviewing those consultants. So we need to come up with questions that we want to ask. And I think Dawn will help us with that. And we would actually, just throw this out now, there should be 2 or 3 people, I think, meeting with Dawn to kind of to choose, or not to choose, but to interview the finalists as a consultant. I'll throw it out there. If the entire board wants to be involved, that is fine. It's just that scheduling everybody and then scheduling the consultants might be a little difficult. But I guess I would propose that Tom and Jess and myself continue to work with Dawn on this, on the issue or trying to find the consultant. And then what I would propose, we would come back to the board with our recommendations. Like, we've interviewed 3 people. This is our first choice. This is our second choice. This is our third choice. But then share enough information with the board so that you'll know also who looks like the best fit for us. Is there any discussion about that? Is someone else really dying to be on this task? Because if you are, I'd like you to join in. So.
Sandra,
Go ahead, Tom.
I would just as soon step back and allow someone else to be a part of that. I would participate if the whole board was doing it, but I would prefer to step back and let one of the newer members.
Thank you, Tom. I really appreciate all of the help that you have given. Is someone else, Jess, are you going to be available, do you think, to participate in helping choose the consultant?
Yes, I am available and happy to continue.
Okay. And then I think one more person, either Dr. Horowitz or Amy Crow-Sunleaf, are you interested in joining in?
I can help out.
Okay. All right.
I have to say that I really don't have any experience doing that.
Okay. Well, I
So-
appreciate it. I think, you'll have a chance when whenever we bring it all back to the board, we'll be able to fill everybody in. But Amy, I appreciate you volunteering. we're going to try to schedule a meeting first thing, either sometime this week if Ms. Sherman has availability, or next week to get started on the task of the questions. What do we want to ask the consultant to make sure that this consultant is a good fit for us? So that's our next step. And what we're hoping is that we, by next month's meeting, at the latest, we'll have those consultant evaluations ready for you. If we get it finished and completed before that, we'll call a special meeting just to move this along, but hopefully we'll have it in order by next meeting. Dawn, do you have any updates for us?
Yeah, I do. So I am working on compiling a list for your small group here to look at, looking specifically if there's any with experience in recruitment of a public health director, which is, you know, a finite group. So I'm going to look for that. I'm going to reach out to my contacts throughout. I'm on a statewide organization that has city and county HR professionals, and ask if they've utilized anybody with great success that we could take a look at and evaluate as well. So I will have that list when we meet end of this week or next week. And one other discussion that I just wanted to pass along, I met with Mandy Dolson. She is the Director of Workforce Solutions at Greater Dubuque Development Corporation. I just had a general meeting with her about workforce solutions, a variety of them, but we did have a lengthy discussion about this upcoming recruitment. And she identified a couple of resources that may be useful throughout this process. One of them is what they consider a prospect list. And they have a system, I call it like a data mining system, where they're able to go out, you know, it's all a computer program, but to identify potential candidates that either identify as being current public health directors or work in public health organizations right now. And so that would be something that we would be able to get a list from them, and they can do that, you know, in the tri-county or, you know, the tri-state region. She pulls a list, just a quick list from Iowa, Minnesota, Wisconsin, and Illinois, and I had over 100 potential candidates on there. And what we'd use that for is we could then pass that along to our consultant, who would then make personal contact. You know, that may be an email blast, it may be a social media, it may be a personal phone call, depending if you know, as they do their research. So, you know, it's getting that, not just being passive in this recruitment, it's having this consultant, this recruitment consultant, being actively searching out some candidates. And then she also discussed some resources that they have that we may want to use during the actual selection process. When we bring candidates in for interviews, you know, they have done in the past tours for potential candidates, where they take them throughout the community, show them some of the great amenities that our community has to offer. And that's just not for potential candidates that may be from outside the Dubuque area. You know, even candidates, you know, that we may have locally I think would be a great experience to see some of the, like I said, some of the amenities and opportunities. And it's an opportunity for us as Dubuque County to show that, you know, we sometimes have to sell ourselves to these candidates because it's a very competitive market out there, and be able to show why our community is a great place to work and live. So they have some resources that she's going to be passed along, and I'll be sharing those as we go through this process as well.
Yes, I think that sounds like a great resource to help us and assist us. And I really like the idea of the tour for the potential candidates that come in. So that sounds really good. I really appreciate your help, Dawn. Do any of the members have questions for Dawn before she checks off? Well, thank you very much, Dawn, and we will get with you tomorrow to get something scheduled, okay?
Thank you for having me. Have a good evening.
Thank you for coming. The next item on our agenda tonight is, let's have a little discussion about the Board of Health meeting times. I've talked to several of the members, and an earlier meeting time has been suggested because our meetings get kind of long and it gets kind of late at night. Adam and Dr. Schultz have left the meeting because they had prior requirements at 7 o'clock, and that actually is probably going to continue to happen. So it would also help if we help them with their participation on the board, if we could move the meeting a little bit earlier in the day. They both said that they would be available during the day at 4 or 5 o'clock, something like that. So I just wanted to open it up to discussion. I know that I'm available earlier, and I don't know about the rest of you. And so what do you guys think?
This is Marcia. I'm available earlier, and I think it would be easier earlier than dragging on quite so late at night.
Okay. Thank you, Dr. Horowitz. And Amy, did you?
I can make as long as I know with enough advance notice, which we get, I can make my schedule very flexible. So,
Okay.
but earlier would be better, especially in the winter when it's so dark anyway.
Right.
It would be nice not to feel like we're going home at midnight, even if it's only 8 o'clock.
True.
Well, and just driving there at 6, it's dark too. So
yeah.
I think it would be nice to.
I
have it
agree.
earlier.
I agree. Jess, what's your availability?
I would second what Amy said, as long as we know in advance, you know, I'm pretty flexible in terms of moving things around. So
Okay.
earlier is probably better.
All right. Tom, did I ask you what do
No,
you think?
I'm open. I can move it. Yeah.
You're available? Okay. Would someone like to make a motion?
Well, do we know what we're trying to accommodate Hendrik and Adam? Do we think that 5 o'clock is early enough? Or should we shoot for 4:30?
They both told me that they would be available at 4 or 5 or 4:30, you know, anytime after 4. I think they were at 4 or later, they could be available.
Okay.
So
I guess then I'd be willing to make a motion to change our meeting time to 4:30.
is there a second to that?
I'll second.
Is there any further discussion?
And it'll still be on Wednesday.
Yes, that's what I anticipate.
And we're still thinking once a month.
For right now.
Okay.
What do you think?
Yeah,
I
I
know-
think once a month is fine.
Okay. And I think sometimes we may need to bump that up to twice a month, but for right now, our regularly scheduled meeting, I think will probably be once a month. Any other discussion of holding our meetings on Wednesdays beginning at 4:30 rather than 6 o'clock? Any other discussion?
Sandra,
Hearing
I
none.
just have a question. I'm sorry.
Go ahead.
You mentioned that the next meeting was in person. I just wanted to clarify, would that be at the courthouse or at the West Campus building or somewhere else?
I like the West Campus building. What are the ramifications or choices, or why do we have to make a choice?
Oh, I was just curious so that everyone knows where to go.
Oh.
There was a question last summer about security with some changes in the laws the last 1st of July. We've had meetings at the West Campus and security hasn't been an issue, so.
Right. And maybe having an earlier meeting, it might be more secure. I mean, I like the room in the health department, the conference room for our meetings. I like it there because it's easier. We can kind of sit in a round table and have discussions. If we meet at the courthouse, we do kind of have to sit in a straight line, and it doesn't really doesn't help our discussions. So
And parking's an issue downtown, especially at 4:30.
True.
We have the option for the public to attend via Zoom too, so.
Correct.
Yeah.
And I think we would like to, maintain that, especially since we can put it on Zoom then, so, or not on Zoom, but on YouTube. So any other discussion, any further discussion? Hearing none, I'd like to take the vote on the motion to change our meeting time from 6 o'clock on Wednesday, on the third Wednesday of the month, to 4:30 on the third Wednesday of the month, to be held in person at the Health Department. All those in favor, please say aye. Aye.
Aye.
All those opposed, please say nay. Hearing none, the motion passes. So our next meeting will be at 4:30, the third Wednesday of the month. And that would be, let's see,
March 16th.
March 16th at the Department of Health. Thank you, very good. The next thing on our agenda, number 9, is the Board of Health Liaison Comments. And Supervisor McDonough, do you have any comments tonight?
Actually, it's been a very long meeting and I just am expressing gratitude to each and every one of you. Thank you. I got a little emotional when Dr. Hendrik Schultz talked about herd immunity and that the numbers look good. It's just been very traumatic 2 years for all of us. And so it's wonderful to hear those words, and I hope I didn't dream them. I hope they really, maybe they'll be reported in the paper tomorrow and I can carry it in my back pocket. So just a tremendous note of thank you to all of you.
Well, thank you. Okay, so the next item on the agenda, again, announcing the next meeting, it'll be March 16th, 2022 at 4:30. And it will be held at the Department of Health. And just before public comments, I would just like to again thank the participants in the meeting tonight, especially the board members. Thank you all for attending. Thank you for discussing and debating our issues and coming to conclusions. A little special shout out to Adam for his presentation concerning the environmental division of the Health Department. Thank you very much to Samantha for giving her reports tonight. We couldn't do this without you, Samantha, and we really do appreciate all the work that you do. And then a thank you to Stacy from the VNA, to Dawn Sherman from Human Resources, to CJ May for giving your presentations. And then a special thank you to Supervisor McDonough for all the support that you have given to this Board of Health. And we do really look forward to working collaboratively with you going forward. So thank you to all of you. At this time, anyone may address the board on areas or on matters of which are of concern to that person and which are not agenda items. If you wish to speak, please raise your hand on Zoom, state your name and home address. Please be aware that the board is limited in our ability to respond to any inquiry, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. We have provided 3 minutes for each individual to make remarks. Does anyone want to make remarks tonight? If you're on Zoom, please raise your hand if you would like to speak. Well, I don't see anybody that wishes to speak tonight. So do we have a motion to adjourn?
I move we adjourn the meeting.
Is there a second?
This is Jess. I'll second.
Any discussion? Hearing none, I would like to take the vote. All those in favor of adjourning the meeting, please say aye.
Aye.
Aye. Those opposed say nay. Hearing none, the motion passes. Thank you very much. We'll see you all next time. And Jess and Amy, I'll reach out to you about scheduling a meeting with Dawn Sherman.
Thank you.
Thank you very much.
You're well.
Great.
Hi, everyone.